Hey guys, how's it going? I figured I would talk to you about insurance. And this involves riders, non-riders, just people in general. Obviously, we have the ACA, Affordable Care Act, or Obamacare. Well, insurance rates have gone up drastically. In most states, I think they've gone up quite a bit, or I think they've gone up in every state. Some states more than others. In Colorado here, it just got really bad. We couldn't even afford insurance last year. So we took a totally different approach, a scary one because it's not traditional. We went with a health sharing ministry. So religion based, so that might, in Christian, that might negate some people to be able to do it or want to do it or this or that, right? Whatever. That's your own call. I'm not here to talk to you about faith or whether you have it or don't have it or what your interpretation of it is. So the company we went with is Liberty HealthSharing. They've been actually pretty good. Surprisingly, my wife was more worried than I was. I figured, what's the worst, right? It doesn't work, but I don't know. People get real worried about that. Well, what if I break a leg and it's going to cost $5,000 and this and that, and they don't cover it? Really, you'd be no worse off because as long as the amounts are still within reason, if you call that within reason, because the deductibles on all those insurance plans out there are so high, $12,000-$14,000. So not only are you paying your premium, that ours was going to be like $1,200 a month. $1,200 a month? I think our mortgage is like slightly more than that. It's like, what the crap? Insurance is going to cost me the same, so it's like having a whole second house payment just for insurance. We can't afford that. I mean, we could afford to pay that a month, but oh my God, that's like, better sell the toys, better sell the cars, better drive a $2,000 beater, not have any fun, not be able to live life, and yeah, it would just totally blow. So, we looked around. What do you do? Looked up and came across HealthSharing. I was like, okay, this gets you out of the Obama fine, so you're not fined for not having insurance. That's a loophole. A lot of people might not know that. So we pay $450 a month, $500 per person deductible, and $1,500 deductible per family. So it's $500 per person, really. So, you can hit those real easy, which we have. You also get one preventative care checkup every year. So my wife did it. I lack in that regard. I should really do it. I probably should do mine next year. But yeah, she did it. There's no bill she had to pay. Everything was submitted to Liberty HealthSharing. I think you can log into Liberty and look. I think they paid like $800. I want to say it was some weird number, but it was roughly $800 for just preventative care for a checkup. So when you figure that, that's almost 2 months of your $450 that they covered, and that was just her. And now my daughter's she's had her checkup and stuff, so that was cover whatever. But a toddler or a 4-year-old, they don't do as extensive as adults for your preventative care. So in essence, if I would have went this past year, which I failed to do, just been busy with all my things going on, but if I would have went, and let's say mine was $800, those two alone are $1,600. That's like almost 4 months of your $450. So when you look at it that way, it's like, oh my God, it's like a no-brainer to do the health sharing. And okay, so my daughter had a deal. She was laying in our bed. and all suddenly could not breathe. We panicked, and I'm not the one to like rush off to hospitals and stuff over minor things. I'm like, hey, yeah. For first it was like a little cough. It's like she sometimes fake coughs, which is a bad thing for your kid to do because it's like crying wolf, and you start to like. And I basically was like, hey, stop coughing, go ahead, fall asleep so we could carry you up to bed. And I was watching some news and stuff on TV while laying there waiting for my wife to get ready in the bathroom. And then all suddenly, like out of the blue, couldn't breathe. And she had, I'm going to say it wrong, crump, yeah, whatever. She couldn't breathe. Her airways were getting restricted. We're trying to ask her, did she put anything in her nose? Did she swallow anything? And of course, she can't breathe. She's getting panicky. She starts crying. Even at 4.5 years old, she wants to respond to us, but she can't. So, I'm like, let's not even mess with this. Let's go. And we just took off, threw clothes on, took off, went to the ER, only thing open, right, hospital. So we go to the hospital, and she kind of settled down at that point. It took like 30 minutes to get there. So by the time we got there, she kind of settled down, and she did throw up in the waiting area. That was pretty disgusting. But they get us checked in. We go in. Of course, they never ask you. I was surprised that the hospital doesn't ask you if you have insurance right away, but that's because of law. Law is that they have to treat you, they have to take you, and only until you're stable, then they can ask you. So they didn't ask us about insurance or anything. We're like, when are they going to ask? When are they going to ask? When are they going to ask? And I didn't really know that at the time. I've read that since, but by the time they asked, we told them, we're like, we're self-pay. We didn't even bring up Liberty HealthSharing because technically it's not a health insurance, and they clearly tell you that on everything. This is not health insurance. It's not traditional health insurance. You're sharing your expenses with other members. Is basically how it works. But just because legally they can't say it's health insurance, it basically acts the same way. It basically is the same thing. And then that's just my point of view. So I'm not acting on behalf of Liberty or any of the health sharing by saying that. I'm just a normal person saying it basically is, really. But to get around the law, loopholes, you know how that works, it's health sharing. So with that knowledge, we told them we're self-pay, we don't have insurance. Oh, well, we had, right away they think you're like dead broke. Oh, well, we have programs to help people out. Oh, okay, and we'll get you all that information. We'll just do up the bill. When you get the bill, call this number, and they're really nice. Call this number, and basically we'll work it out with you because they want something. They don't know how broke you are because they haven't asked any questions. And it's my belief it's none of their business really, right? And we want to pay something because we did use services. So, she gets treated, it's like an in and out, but we had to sleep there. They had a code blue elsewhere, so everyone was occupied. And I'm sure we got charged for the room during this code blue that we would have been checked out of, but because they were all hands on deck helping somebody, which they should be, you know how hospitals work. It's probably in the computer, like, you stayed this long and you're going to have to pay this. Well, they're all gone. They even apologized, like, oh, we would have had you guys out of here 2 hours ago, but because of this, and it wasn't until after we got the bill, I was like, yeah, I bet they charged us for that time, even though it wasn't our fault, right? So right away, the bill's like $5,000. Just because you're basically in the ER. It's totally gimmick. And you can go to the hospital's website page and they'll list if you have a scheduled procedure like a chest x-ray, which they did a chest x-ray, make sure there was no obstructions in her airway. It's like $70 if you schedule it, right? Normal scheduled chest x-ray. It was $680. Okay, I understand. The chest x-ray person has to work at night, right? It's not a daytime type gig. Okay. So instead of $70, I could see it being like $140, right? Because premium, he's working at night. I mean, honestly, it's a hospital, so they're going to be working whenever. But benefit of the doubt, premium, Should be like double. No, $680 just because you go in there. Other things the same way. Well, my wife being a pharmacist and in the medical field knows that like you can look up Medicare coding and rates and stuff in Colorado, and you look that up, and basically the best we could come surmise is if we would have had Medicaid, they would have paid $400 total. That's it. That's all the hospital would have got. So, so they gave us a bill. It's $5,000, but right away, we want you to pay because you're self-pay, $2,500. We're like, no, we're not going to do it. And you're like, you might be thinking, well, why didn't we just submit that to Liberty and not deal with it? Because, whether it's your whether you have insurance or not, you should really be concerned with how a place is billing. So it just ticked us off that here's all your scheduled payments, here's what you charged, and here's what Medicaid would have paid. So we're going to offer you $800. They were like, no, not going to do that. Okay, well, what can you do? We'll go back and investigate this and see if everything's billed right. Because we're like, really? For the room? What is a level 4 or whatever? There's only 5 levels. What's a level 4? What's this? And what's that? All these billing things. We want the codes to this stuff because we're going to look it up. At this point, they know we're going to look it up. And they do their investigation into the billing. They come back and they were like, the doctor didn't order the oxygen. That was $180 for oxygen. Just because oxygen, okay, we know it doesn't cost nowhere near that. $180. Doctor didn't order, we'll knock that off. The room, it wasn't really a code 4, it was a code 3 or room 3, whatever, different emergency level. They knocked that down, which that was the biggest one. That was like $3,500, $3,800, it was something like that. And they knocked it down. And then with whatever discount they applied originally to the $5,000, they still applied, and it brought it down to $1,800. We want you to pay, because you're self-pay, $1,800. In the meantime, we're submitting all this stuff to Liberty HealthSharing, so they know what's going on. And they're like, yeah, we'll call too and try to work it out. And we don't know if they ever did call in between this, but we were on top of our game. We'd get something in, we'd call them right away. So, the hospital and Liberty, both of them. And if you pay within 60 days, we'll knock another 10% off that $1,800. So you went from $5,000 to $2,500, hoping we'd pay. We still complained, and you dropped it down to $1,800, or like $1,600, just over $1,600 to just pay to get rid of us because you want some money, right? You're seeing these people are fighting. So Liberty was like, yeah, we gave them everything. They were like, yeah, you don't have to worry about it, and we'll go ahead and pay this. And yeah, we'll probably pay within the 60 days because they want to save money too. I think they were really proud of us, if you will, that we saved the members more money, because we could have just been those people that are like $2,500. We only have to pay because my daughter $500 at the most, but she had already had other little things going to kids get sick and go, and it's just, so we probably already had hit that $500, so we would have been out of nothing. But we took a little bit of our time, which did not take much. You get a bill in the mail, you make a phone call, maybe 5 minutes, 10 minutes, and it worked out great. So I can't say enough that the HealthSharing actually does work. And I've been wanting to make the video for a while, but I didn't really want to talk about HealthSharing because it's not my channel's focus. But so many riders ride and stuff. And that's the other thing with HealthSharing. I can go out, get hurt in Utah, New Mexico, wherever, Alaska, and I can go to the doctor and submit and be taken care of. A lot of the insurance companies in Colorado, traditional insurance, are saying you have to go see this doctor. You can only go to this hospital, but it gets worse. not only can only go there, and it might be, and it's like almost down to the like county level. It that if you go to, say I go to Moab, which I do, Utah, and I get hurt there, you're not covered. So you'd be one of those people like, hey, as long as you're not dead, like on death's door, you're going to be like, hey, to your buddies, load up in the truck. I broke my leg. We have to drive back over to Colorado so I can go to get treated. It turns it into this whole like, can I get back to my state? That's not health insurance, guys. And the people that are like, oh, but it's helped so many people. It really hasn't. It's gotten worse and worse. And, I hate to get in the whole political side, but, the whole getting rid of the artificial boundaries around states, some people just don't understand that. But I should be able to buy insurance from New York if I want to, or New Mexico, or Texas, or California, or wherever. I should be able to buy insurance. Why? Why is there a restriction that I have to buy insurance from these companies only in Colorado who are all leaving? The last time when we tried to get insurance, traditional insurance, my wife talked to a really nice person at Blue Cross Blue Shield that clued us in all this and said, this is how we're going. When you talk to these other companies, ask them about whether you can use that insurance when you go travel, because she goes, as far as she knew, every single insurance company in Colorado was going to make it so you could only use it within state or even within your own county. What the hell? So I can only go to this doctor in this hospital, no matter if I'm out skiing in Aspen. So I go hit a tree and have to go to the local hospital. Now I'm out of pocket totally because I can't. It's not in the network. The whole network thing, that's always been a scam. And it might even be cheaper coverage there, or the hospital might charge less, but if you're not in the network, it's just a gimmick. And it's really messed up. So you guys that are paying like $1,200, $1,500 a month and have $14,000 deductibles, what are you doing? You check into HealthSharing, honestly. I mean, $450 a month for a family, and you're more proactive. You go to the doctor, you're like, I'm self-pay. You know what they do? They say, they do all the tests. Oh, you're sick with this or that. Here's some free meds, because they always have samples. Here's free meds because you're self-paid. They don't need to know about Liberty. Now, my doctor, I had one time with my daughter said, oh, we have Liberty HealthSharing. They took the card. They were like, yeah, don't worry about it. But you know what they gave off? They only gave $7 off, versus like if I were just been like, I'm self-pay, they probably knock like 20% off, because they just want you to pay. Now, of course, I guess you could have a family doctor that just says, we don't want to deal with you. But, we've been going there for a long time. So if it's an established relationship, you're usually okay. I won't say always, but you're usually okay. And that's the great thing with HealthSharing. You keep going to your same doctor. Just tell them you're self-pay. They just put in the computers like health insurance. If you want to show them the card, if not, they still just send you a bill within a month or two. You know how long some doctors' offices and especially hospitals can take forever. Yeah, and you're good to go. I would not be afraid for my wife to be pregnant and have a kid under HealthSharing. I feel we would be taken care of, and that's a good thing. And it's a good feeling to know that they stand behind their product, and that's really helping people with them, because they're not a business. So I kind of wrote this in a comment on something about health insurance just recently, but they charge $450. They could charge like $800 a month, $600 a month. People would pay it because no one can afford the $1,000 plus a month and those crazy deductibles. It's crazy, but they're not in the business to make money, so they don't need to charge those rates. And there's very strict guidelines to, they bring in so much money, they have to make sure they allocate that money, and they can't have a huge excess of money, and it gets, I guess, really complicated. And so that's good. That's good. You know, they say, like, you can actually even participate if you wish with Liberty. At least with Liberty Health Sharing, is you could actually send your money directly to those people, or you can have them just take care of it, which we just set up that way. We don't have time to always log in monthly and say my 450 is going to Johnny in Milwaukee or something. You know, yeah, I mean, that's a nice feature though. I mean, it makes it more personal, and you can add notes like, hey, get well, and stuff. If you want to do that, I believe the note thing is there. We just briefly looked at that part and we were like, oh my god, we thought we had to do it that way, or like that was the one, like, oh no, we have to remember or do that, that's gonna be a pain. But no, they'll also just take care of that, which is awesome. And yeah, you know, and you have $1 million of coverage. So if you need more coverage, I think what they do is they kind of put you on like, hey, please donate to so and so because you had this horrific, you know, you have cancer or whatever, and then people will donate, and people are usually generous people, so you'll get some money here and there, and they'll show where they're at and where they need to be because the bill, you know, the bills might be $300,000, you know, and they just, you know, kind of shows you, which is nice. So you can always donate extra, and because it's a ministry, that's tax write-off for people that care about the tax side of things and motivates them to donate more. So it's a good experience, and it's worked out. I mean, do I wish for traditional healthcare? Yes, I do. I mean, traditional healthcare, that needs to be fixed. But you know, health sharing has worked, so I'm not opposed to that staying around either. It's been great. So guys, thanks for watching. Please like, subscribe, leave a comment if you have insurance problems or whatever, or you used one of those different ministries, because there's many of them out there, and let the audience know, you know, how that has worked out for you. So you guys take care, have a happy Merry Christmas, and a Happy New Year.